There are a number of things that Medicare does not cover, and we certainly need to understand so that we don't get hit with surprises when we think something that will be covered is not covered. Now, with that being said, Medicare is absolutely fantastic. If you're coming into Medicare off of group health insurance, or maybe you've had Obamacare individual insurance coming into Medicare, chances are Medicare is going to be much better. It's going to be lower out-of-pocket costs as long as you set it up correctly and do it the way that you want to do it. It's going to be fantastic, and it's going to work very well for the rest of your life. So let's understand exactly when things are not covered. I'm going to go through them all, so stick with me till the end. I'll show you exactly kind of how to manage things and understand some of your choices, because, well, again, we just don't want surprises, especially in a medical situation where it then becomes financially problematic as well. So when we talk about things that Medicare doesn't cover, let's understand first that Medicare, pretty much health insurance, is exactly what it is. So it has a Part A and a Part B. Part A covers stuff that happens in inpatient hospital visits, so if you're admitted into the hospital. Part B covers the other stuff, doctor's visits, specialists, outpatient surgery. They break it down into different pieces for some reason, but that's really the gist of it. There's not too much complication to it. Now, you do have a choice when you come into Medicare whether to stay on that original Medicare or go into a Medicare Advantage plan. If you go into a Medicare Advantage plan, it changes things dramatically in how things function, how things are processed, how things are authorized, things of that nature. A Medicare Advantage plan is run by a private insurance carrier. It's not run by Medicare, so it takes a lot of the control away from you and gives it to that private insurance company. It's a for-profit type health insurance. It's not something that I recommend. I certainly wouldn't do it myself. I will do everything I can to stay on original Medicare, A and B, probably have a supplement, likely have a Medicare drug plan to go with it. But let's go through some of the things that Medicare does not cover. The first one, and some people understand, some people are surprised, it does not cover long-term care. So long-term care would be considered nursing home care. We certainly don't want to be in a situation where we need nursing home care, but you need to understand from a Medicare standpoint, that's not something that's covered. So Medicare covers rehab nursing care. So if you're admitted into a hospital, and the way it works with Medicare, you need to have a hospital admission of at least 3 days. So you need to be physically admitted into the hospital. There's another situation here where if they have you in for observation, it really messes things up from a coverage standpoint. So that's a different video. I have that as well. Just you can search through my channel. But if you're admitted into the hospital for at least 3 days, and then they release you to a skilled nursing facility for rehab. So in other words, it's going to help you get back to where you were before. So that is covered under Medicare, also covered under a Medicare supplement plan. And Medicare covers it up to 20 days. The Medicare supplement plan then expands that up to 100 days. Now, this is also something that can be problematic under a Medicare Advantage plan. Medicare Advantage controls this type of coverage, and they generally, it's one of the bigger complaints where they kick people out of skilled nursing before they feel that they're ready to leave and they're not ready to go home like they were beforehand. So certainly important to understand that. But outside of that, long-term care, where it's longer than that, it may be months or years in a skilled nursing facility, that is not covered under Medicare. There are separate policies for that. They're extremely expensive. They're hard to figure out. It's one of the bigger problems that has faced the healthcare industry is how to handle long-term care, but something you need to kind of be aware of going forward. So just understand that. Also with Medicare, technically it does not cover dental care. So dental care, just like your health insurance coming into Medicare likely did not cover dental care. You probably had a separate dental policy alongside your medical coverage. It's the same within Medicare. So Medicare would only consider or only cover something that would be an emergency situation. So if you had in a car accident and you needed jaw surgery, something like that, that would be covered under Medicare. But outside of that, regular dental care, cleanings, x-rays, fillings, crowns, all that kind of stuff is not part of Medicare. Now, some Medicare Advantage plans will tell you that they do cover dental, but you would likely also find out it's very limited in what they cover. So they may have checkups and cleanings and things like that, but they don't generally have the more major type care, crowns and fillings and things of that nature. So with dental, it's like it was when you were at work. You would have a separate dental policy that covers all that stuff. We actually have one that doesn't even have a network of dentists. It's an indemnity policy, meaning when you go to the dentist, this company sends you a check and you get reimbursed for things you spent at the dentist's office. So it makes it easy to use, where you don't have to worry about finding a dentist that's in that dental network. So just understand, so it doesn't cover dental coverage on Medicare. Now, Medicare also doesn't cover vision and hearing. So some people don't even really think about that coming in. You might not need it when you first start, but you might need it later. But vision and hearing is not covered under Medicare, with the exception of something like cataract surgery, where Medicare does cover cataract surgery and the following treatments after cataract surgery. It does not cover your standard vision, eyeglasses, contacts, checkups, things like that, or hearing aids, hearing tests, things of that nature. But generally, most dental policies also have vision and hearing. So it's usually dental, vision, and hearing all in one. So that runs alongside, just similar to what you would have had previous coming into Medicare. But again, a lot of people haven't even thought about it because they haven't needed it. So they don't think about it coming in. But it is part generally of a standalone policy for dental, vision, and hearing. Standard original Medicare also doesn't cover prescription drugs. So prescription drugs also are a separate piece. It's Medicare Part D for a drug plan. So you would likely, if you stay on original Medicare with a supplement, you're likely going to have a Medicare drug plan that goes along with it. It's just something that you get separately, and that's run through a private insurance company, and you can choose based on the medications that you take. It's similar to what you've probably had coming in, where you have tier 1, tier 2, tier 3 type medications, and you want to make sure you match it up best with what you currently take. And you can change that at the end of each year. Now, these days, there's also some really good discount services like GoodRx or the Mark Cuban Drug Cost Plus discount prescription programs that may even be better than a Medicare drug plan in certain circumstances. Depends on the medication you take. If you take basic, regular, generic type stuff, you may be better off with a discount plan outside of Medicare, or if you take complicated things, very expensive stuff, then a Medicare drug plan is probably going to be what's going to work best for you. Some other stuff that Medicare doesn't cover: cosmetic surgery. So obviously, if it's elective surgery, it's not medically necessary, you're choosing to do it, Medicare is not going to cover that. Doesn't cover over-the-counter prescription drugs, like most health insurance or drug plans would also not cover over-the-counter prescription drugs. So stuff like that's kind of common sense, but again, we just don't want to be surprised. And certainly cosmetic surgery these days can be a number of different things. So just understand that if it's something you choose to do instead of something you need to do, that it's not going to be covered under Medicare. So here's a big one that kind of surprised people too, and you don't really necessarily think about it: outside of the United States. So Medicare technically does not cover medical expenses that occur outside of the United States. That's a pretty big deal, because you may very well be traveling more than you have once you're in your retirement years, and you may be traveling outside of the country. So you have to take that into account and either understand that you don't have coverage, or there are travel plans or things like that. Now, if you stay with original Medicare and a Medicare supplement plan, generally the supplement plan is going to have coverage for stuff that happens outside of the country. So that can be a big help if you do much traveling. If you go to a Medicare Advantage plan, pretty rarely will they have not only stuff outside of the country, a lot of times they don't have coverage outside of your area. If you travel to a different state, they're likely not going to have coverage other than emergency coverage, where if something happens, they will take care of the emergency part, and then they will want to bring you back to where your local area is. So with a Medicare supplement plan and original Medicare, it's not that way at all. Original Medicare with a supplement plan, you can use it anywhere in the country without any restrictions whatsoever. You can go to any doctor, any hospital, anywhere in the country, so you don't have to worry about that if you do a lot of traveling. And then again, it will also cover outside of the country if you're traveling to Europe or wherever it may be. So certainly very helpful in that scenario as well. The last thing I'll talk about real quick is chiropractic and acupuncture. It does not cover those services unless it's for low back pain. It will cover chiropractic for spinal manipulation. It says limited, so it's kind of unclear. You need to find a chiropractor that would understand how to bill Medicare and make sure that they get everything done through Medicare so that you're not paying for it out of pocket. And then acupuncture is simply only for chronic low back pain. So again, you would certainly in that type of situation want to find a provider that knows how to run it through Medicare, so that way they don't have to charge you out of pocket. But pretty easy, to bring that up, and they should understand exactly how to get that done. So that gives you a pretty clear idea on a handful of things that aren't covered by Medicare. Now what we do is we make sure that we set this up correctly, the way that maximizes everything that you want to have happen with your health insurance going forward. So you can visit my website, MedicareOnVideo.com. You can give us a call, and certainly make sure you download my book, Medicare Made Easy. It gives you all the information about Medicare, and that's what we do. We just make sure we put everything in the right place so we don't have any problems and we don't think about health insurance going forward. So I hope you found this helpful. Have a fantastic day.